Welcome to lesson 2 of Principles of Health Science. Today let's look at teamwork. So let's define what a team is to start with. A team is a group of people who work together to achieve a common goal. Now, a team can be influenced by many different things, including the different ideas, the different personal goals a team has and their members have, and the interactions between team members that bring in and encompass all of this are known as team dynamics. So team dynamics are interactions between team members that are influenced by factors. And some examples of positive team dynamics would be good conflict resolution, good communication, and poor team dynamics are miscommunication or a just lack of communication when it's necessary. So team dynamics can either be positive and lead to positive things, or they can be negative and lead to poor team success. Now, when teams work together, there can be misinterpretation and there can be poor team dynamics, and the challenge of team relations come in from having different people working together. So all these different people in a healthcare team or any team come from different backgrounds. They come from different education, whether that be like different social development, or formal education. And they come from especially different interests or personal goals. And all these people have to work together to achieve quality care, but you can't really do that if you're having a lack of positive team dynamics, right? And so taking these different skills that people have and assigning them based on the thing that they're good at, or to give another person responsibility for a specific task, is called delegation. So it means to basically give responsibility, so give work, right? And there are 5 rights of delegation that these are very important for you to understand. And let me list them out. So there are 5, and the first one is the right task. Okay, all of these start with a right. So there's the right task. There is so that means the appropriate task for the person. There is the right circumstance. Can this person do what you're asking them to do? There is the right person. Is this person even the correct person in the first place? There is the right direction. Are you providing support to them, or are you communicating well? So direction/communication. And then there is the right supervision. Are you providing them the right leadership in that situation? Okay, and an important and easy way to remember this is terrific care. Let me highlight. Terrific care promotes client. So instead of direction, you should probably write communication. I'll just write comms here. Terrific care promotes client safety. Okay, that's TCPCS. Terrific care promotes client safety. Just repeat that a few times and then you'll remember the first letter, and then you'll remember the 5 rights of delegation. Now, it's important to understand that while delegation is important, a team is a group of people who participate. And in our previous notes, we defined that anyone who participates in a group is a leader. So it's important to understand that all departments are responsible for quality patient care, even if they aren't providing hands-on care. So all departments need to do this. They need to do everything. They need to be providing good quality healthcare. Now, there are a couple types of healthcare teams, and the first type of team is a nominal group. And a nominal group is one doctor. And this one doctor could be a single pediatrician, okay? This one doctor will lead people to different specialists. And then there is a unidisciplinary team. And this, as its term suggests, is one discipline. And this could be a single clinic for ophthalmology, right? And it's one discipline, one specialization, one type of work, one type of care. Okay, and then there is going to be multidisciplinary team. And then there's a interdisciplinary team, okay? Now, what is the difference? Well, in a multidisciplinary team, there's going to be multiple different disciplines, but they work alone. So they all have their own goals, and this could be a single patient seeing a nutritionist, and then they see a physical therapist, and then they see a doctor, and then they see a different specialist of doctor, they see a cardiologist. Like, that's a multidisciplinary team. They all have different goals and different recommendations, and they're not working together, really. But the interdisciplinary team is working closely together, and this could be an athletic trainer and a physical therapist and a psychiatrist, maybe, a therapist, and then a doctor working together, all to better a patient from a really terrible sports injury or something like that. And they're working interdisciplinary, they're working together. So they have different disciplines, different goals, but the main goal they're all working together to achieve is to better this patient. So work together. Now, once a team is formed, they need to come up with the team goal they want to achieve. And this team goal might focus on the professional needs of a group, or it can focus on the patient needs, or it can focus on the team needs. Okay, and then once they create this goal, they should have a mission statement. And this mission statement will tie in to all the aims, values, and overall plan of this team. So the mission statement is something that all members can participate and hold true to. And a long-term goal is something that the team will want to achieve in the more distant future. And healthcare teams have to develop roles, and these roles begin by identifying the tasks and then negotiating the roles. Okay, so let's write out roles equal task plus negotiation. Okay, and decisions about a person's roles will be determined by their availability, their training. So you want to pertain to the scope of care, so you shouldn't do anything that's out of your scope of care, and their preferences. Now, there are different types of leaders that we talked about in the previous set of notes, but there's a professional leader, there are good team leaders, and there are successful leaders in both of these categories. And it's just important to go back and look at what a good leader looks like. But a strong professional leader will respect their team and all their rights, and then they will understand and promote democracy. They'll work towards the goal, which I highlighted is a very important part of being a team leader and a strong professional leader, and they will understand his or her strengths and weaknesses. A good team leader will do the same things, but they'll be very confident, they'll communicate well. If you're working with a very close team, good interpersonal communication is very important. They'll show optimism, they'll be open-minded, they'll give credit, and they will be very, very dedicated to reaching the best possible care or standards and holding true to that goal. And successful leaders are very good at organizing, and they're allowing everyone to share their voice, being open to criticism, motivating people, monitoring the progress, and providing feedback to members. Now, there are two types of communication. There is interpersonal communication and intrapersonal. Interpersonal communication is when the message is being given to two people, or two or more in this sense. So two people are talking, or they're sharing, they're communicating. And then in intrapersonal communication, it's internal. Intra means inside, within. And this is you thinking. This is one person just conversing something inside their own mind. All right, and then effective interpersonal communication is very important for a successful team. So interpersonal communication is very important in this part of our notes. And then a clear and effective team will have strong communication, and some other important communication practices is having effective systems for recording patient information and having stand-up meetings or meetings to evaluate progress and how to make this team work better. And there is something that arises when we have people working together that's almost never avoided, and it shouldn't be avoided, which is conflict. Now, conflict is not a bad thing. Conflict leads to new improvements, and you'll learn about this a lot in speech, but when you have conflict, that's when a group progresses and gets out of the norms stage. And it's important that effective teams have good conflict resolution, because that's a part of good team dynamics. And usually you can resolve minor conflicts by talking them out. So let's write minor talking. But sometimes when the conflict gets too out of hand, even you can think back to group projects, right? When you have such a big argument, you'll need a facilitator. Now, what is a facilitator? A facilitator is someone that can help resolve conflict, right? They come in from outside the team, or they can be a part of the team, but they will resolve conflicts. So it's just a person who solves things to solve. And this can be your teacher, right? If you're working in a group and then people are starting to disagree or fight or get really mad, you're going to have a facilitator who comes in, which can be the group leader, it can be another fellow student, or it can be your teacher, and is like, hey, let's talk this out. And then you're going into the talking part. And It's important to give all members a chance to express their views when you are resolving conflict. So let's talk about effective strategies. So allow expression, whether that be frustration or any type of input. And then you want to be respectful. You need to identify the problem. So respect. And then you want to identify the problem and list all possible solutions. Okay, and then you want to focus on common interests. And for example, if you're having problems between what you want to do for a patient, you want to focus on, well, we all want to make this patient better, right? And use objective criteria instead of subjective. So if you say that this one thing is doing poorly, take data, show how it's doing bad and how your possible solution is going to do better rather than just using your opinion. And then invent new solutions where all members can gain things and learn, or at least you can reach your goal in a way that it's not harming your team members or your relationship with your team members. And then you want to implement that plan, and then again having meetings and talking about what you did, evaluating and problem solving the process even after implementing this plan. So that is teamwork.